We are waiting for Aisha, but she say she can't enter it.
I don't receive the request. Maybe you need to ask her to request it once again.
All right, so can you hear me?
Yes.
Okay, today I'm going to present about filler table. So for the first thing is uh, about the trigger is Maria. She is 48 years old. She is working in Kuala Lumpur as a clerk, and she is accidentally injured her left palm while cutting onion, and the blood continuously bleed from the injury site. So what we're going to do today is we're going to explain about hemophilia uh, and process of blood clotting, thrombocytopenia, to discuss on how to stop the bleeding, to discuss about the blood clotting factors, and to explain about body reaction to bleeding. So the last one is to discuss about blood disorders. So the next slide is.
So first about hemostasis. Hemo mean blood, stasis mean standstill. So hemostasis is your body natural response to stop bleeding and repair damage after an accident. So this capability is normally beneficial as it conserves blood and prevents illnesses. In certain circumstances, the process does not perform as it should, resulting in excessive or hypercoagulation or insufficient hypocoagulation clotting. So there are 4 stages of hemostasis. The first one is constriction of blood vessels. Second, formation of temporary platelet plaque. Third, activation of coagulation cascade or involve clotting factor. And last one is formation of fibrin clot. Next.
Next is blood clotting process. So in blood clotting process, it has 4 processes, which is injury, blood vessel constriction, which is vasoconstriction, platelet plaque, and also fibrin clot. So the first one is when injury, the first phase of the blood clotting process is when a blood vessel becomes damaged. And then this can be in form of small tear, the blood vessel wall that may leak. So next it's vasoconstriction, which is blood vessel constrict to control the blood loss. So it will limit the blood flow to the affected area. And then platelet plaque. Platelet plaque is the body activates platelets At the same time, chemical signals are released from small sacs in the platelets to attract other cells to the area. So they make a platelet plug by forming a clump together, and a protein helps the platelets to stick together. So the protein that helps the platelet to stick together is the fibrin fibrin strands. And then fibrin clot. When a blood vessel becomes injured, so the coagulation factors or clotting factors in the blood are activated, and the clotting factor proteins stimulate the production of fibrin, which is a strong and strand-like substance that forms a fibrin clot. So then the fibrin clot strengthens and then dissolves when the injured blood vessel was closed and healed. Next.
So for blood clotting stage, we have 3 stages. The first one is formation of prothrombinase. Second stage, prothrombinase will convert prothrombin to thrombin. And last stage, thrombin will convert the soluble fibrinogen to fibrin tract. So the first stage, formation of prothrombinase, it will be done through 2 pathways, either through extrinsic pathway or intrinsic pathway. And for the second and the last stage, these 2 stages are done in common pathway. So we will see the pathway. Next slide. Okay. So for extrinsic pathway, tissue factor, which is thromboplastin, is leaked by damaged tissue into the bloodstream to initiate prothrombinase formation. So formation of prothrombinase in extrinsic pathway will take in seconds. So this will be helped by the presence of ion calcium with the combination of clotting factor 10 and 5. So it happened in very short time. For intrinsic pathway, the reaction takes several minutes to occur, and the activation occurs when damaged endothelium and platelet come in contact with collagen of blood vessel wall. So it results in
Did
clotting
the
factor.
extrinsic and intrinsic occur at the same time or different time?
Different time, because it either extrinsic or intrinsic. Kalau sebab kita nak pathway 2 ni untuk form prothrombinase.
Which one come first, or it can come occur at the same time?
It can occur at the same time.
Aisha, you agree? It can occur at the same time? Extrinsic and intrinsic, they occur at the same time or different time?
At the same time.
At the same time? What makes the blood vessel choose extrinsic or intrinsic? How they can choose which pathway that they want?
Maybe by looking at the damaged tissue or cell, maybe Kalau macam tissue trauma, guna extrinsic pathway. Kalau just intrinsic pathway ni kalau damage endothelial cell.
Tissue trauma or blood trauma?
Blood trauma.
Blood
Kalau
trauma.
intrinsic pathway.
Kalau extrinsic?
Extrinsic tissue trauma.
What's the difference between the tissue trauma and blood trauma?
Kalau tissue trauma ni maybe if we look at the diagram, tissue trauma can be seen the luka, the damage.
Okay, so inside this case, which one do you think?
Extrinsic pathway.
You think it's extrinsic? Why do you think so?
Because she bleeding because cut.
Because of the cut. Why is not intrinsic? Why is not intrinsic? Why they choose extrinsic?
Maybe because the cut is not very deep.
It's not too deep.
Yes.
Okay, good. So if it's too deep and it's also affecting the small area inside the blood, the body will decide to use the intrinsic pathway. So what you need to know is determine the severity of the wound. Okay, if it's only the minor scar or minor cuts, don't really give a lot of blood coming out. Maybe 1 liter, 2 liter, maybe you will die. Okay, but if that's the case, then maybe they are manipulating or using the intrinsic pathway. But if it's small one, just like a knife, minor cuts or incision, they are using the extrinsic pathway because it's only the tissue level, not really involving too much of the blood vessel. All right, so they have to choose. Both not are happening at the same time. They have to choose whether A or B. Right. So in the common pathway, they share the same pathway. When they have this prothrombinase that functions to continue with the thrombin production. Okay, they are towards the formation of the blood clots. Sorry, the fibrin networks. So they share the same pathway. This is the only pathway. Means they will take some time to reach this. Okay, so you always look at the severity for the blood to clot. If you have like severe injury during the car accident or maybe severe one, it will take longer for the blood to clot. And of course, you need an extra blood from the donor to replace the blood that has lost, because you cannot stop it based on this mechanism. It's too much blood coming out. Okay, so you cannot just relying on this blood clotting mechanism. No, if it's too severe, the only thing is the blood transfusion or blood donation. But if it's just a minor one, maybe you can consider that this this mechanism, the whole hemostasis, can help to stop the blood automatically. Okay, I'll continue.
Okay, so for this, I'm going to present about blood clotting factors. There are a few blood clotting factors that we're going to discuss. So for the first one is factor number 1, which is its name is fibrinogen. Its nature is from plasma protein, and it can be found in liver. And its functions is in the common pathway. It will convert fibrin. It will convert fibrin, which is insoluble wet substance of clot. So the second one is factor number 2. Its name is prothrombin, and same like fibrinogen, it's this plasma protein and could be found in liver. It also involved in common pathway, which is will be converted to thrombins. The third one is tissue factor. Its nature is plasma membrane and glycoprotein. It could be found in tissue cells. It will activate antecedent pathway. Next is calcium ions. It is an inorganic ion, and it's from plasma. It is needed for accessionally on stage of coagulation process, and it will always present throughout the process. So the next one is proaccelerating. Its nature is plasma protein, and it is from liver and platelets. It involved in common pathway. Next is proconverting. Same like previous, its nature is plasma protein and will be found in liver. It happens in both extrinsic and intrinsic pathway. So next is anti-hemophilic factor. Its nature is plasma protein and its source is liver and lung capillaries. It involves in intrinsic pathway. Deficiency of this factor will result in hemophilia A. So next one is plasma thromboplastin component, PTC. Its nature is plasma protein and it is from liver. It involved in intrinsic pathway, which then its deficiency will result in hemophilia B. Next is throat factor. It is from plasma protein and could be found in also in liver and involved in common pathway. So the next one is plasma thromboplastin antecedent. Its nature is plasma protein and also from liver. It involved in intrinsic pathway and also its deficiency results in hemophilia C. Next one is hegemon factor. Its nature is plasma protein activated by negatively charged surface. Its source is from liver and it involved in intrinsic pathway. Also, it activates plasmin, initiate clotting in vitro, and its activation initiate inflammation. So the next one is fibrin stabilizing factor. Its nature is plasma protein and it source from liver and bone marrow. It is involved in cross-linked fibrin and forming a strong and stable clot. So the other proteins is Wilbrand factor. It often associates with subendothelial connective tissue, which is then served as a bridge between platelet glycoprotein, GPIB, and IX and collagen. Next is protein C. It is activated to protein CA by thrombin bound to thrombomodulin, and then it will degrade factors VII A and VE. Next is protein S. It is acts as a cofactor of protein C. Both protein contain GLA residues. Next is thrombomodulin. The protein it is a protein on the surface of endothelial cells. It binds thrombin and then activates protein C. The last one is antithrombin 3. It is most important coagulation inhibitor. It will control activities of thrombin and factors IXA, XA, XIA, and XIIA. Next.
So now I will present about blood disorder. So there are a few blood disorder that I found. The first one is anemia. Anemia refers to the number of conditions that cause lower than normal level of red blood cell or lower than normal level of hemoglobin. This condition lead to deficiency or in oxygen supply throughout the body. The second one is hemophilia, that refer to the number of conditions that impair the clotting or coagulation of blood. This condition can cause frequent and excessive bleeding. Next one is deep vein thrombosis, that refer to formation of blood clot. This blood clot can interrupt blood flow. They can also be dangerous if detached and travel to the lung. The next one is sickle cell disease, refer to hereditary disease, which cause the red blood cell to maintain an abnormal and rigid sickle cell. Next slide. Other than that, we also have thrombocytopenia, which is an abnormal small number of platelets in circulating blood. Hemochromatosis disorder of refer to disorder of iron metabolism characterized by excessive absorption. Hodgkin disease, which is marked by chronic enlargement of lymph node. Leukemia, which is a progressive proliferation and abnormal leukocyte. And the last one is non-Hodgkin lymphoma, which is lymphoma other than Hodgkin disease. Next slide.
Hemophilia is a rare disorder disease which the blood does not clot in the typical way because it does not have enough blood clotting proteins, clotting factors. If you have hemophilia, you might bleed for a longer time after an injury than you would if you blood clot properly. Small cuts usually are not much of a problem. If you have severe from the condition, the main concern is bleeding inside the body because it can be life-threatening. For the etiology of hemophilia, hemophilia is easily inherited, meaning that it is passed on the affected child through a parent's genes. So, sometimes hemophilia can occur when there is no family history. This is called sporadic hemophilia. About 30% of people are infected with this. It is caused by mutation of the genes. When the father has hemophilia, but the mother does not have it, none of the son will have hemophilia. However, all of the daughters will be carry the hemophilia genes and they will become the carriers. Women who are carriers can pass their abnormal genes to their children. When a carrier marries a normal adult male, there is a 50% chance that the sons will have hemophilia and a 50% chance that the daughter will carry the gene. Next slide, please. There are 3 types of hemophilia, which are hemophilia type A, B, and acquired. The most common hemophilia is the type A. It is known as classic hemophilia. It is passed down from the parents to children, which is characterized by the missing of defective factor 8 clotting proteins. When injury occurs, people with hemophilia A would have a weak platelet platform, incomplete, or people or daily fibrin clot formation that allows bleeding to continue. Next hemophilia is type B. It's known as Christmas. Disease named by the first patient who had in 1592, Stephen Christmas. It is second most common type of hemophilia, and it is characterized by deficiency at blood clotting factor 9. For the last type is acquired hemophilia. It is a rare autoimmune disorder characterized by bleeding that occurs in patients with no family history of hemophilia. It can be said that genetic change or the spontaneous mutation. Autoimmune disorder occur when the body's immune system mistakenly attacks the healthy cells and tissue instead of attacking the pathogen. Other autoimmune condition associated with acquired hemophilia are pregnancy, cancer, and drug reaction. Next slide. For the sign and symptom, in mild cases, a person may experience nosebleeds, bleeding from the mouth or bleeding from the gums, excessive bleeding after dental or other surgical procedure. System of the mild forms may not appear with until at the heart in people who have it. In mild cases of hemophilia, a person may experience easy of excessive breathing as well as excessive bleeding after surgery or trauma. Doctor can frequently diagnose mild cases by the age of 5 or 6. In severe hemophilia cases, a person may experience spontaneous bleeding, most commonly in the muscles or joints. This may result in pain and swelling. Next is bleeding for a long time after an incident, especially after an injury to the head.
So next is thrombocytopenia. What is thrombocytopenia? It's a condition of low platelet count in blood, which is lesser than 150,000 platelets per microliter of blood. The normal range of platelet in a normal person is 150,000 to 450,000. Whenever it's lower than 150,000, it is considered at thrombocytopenia. Platelets, or we also can call it as thrombocytes, are colorless blood cells formed in the bone marrow. Platelet will stick together to form a plaque to seal a wound. The plaques are called blood clot. So the low platelet count can happen due to following reasons. First is bone marrow does not make enough platelets. Second is bone marrow makes enough platelets, but the body destroy them and or use them because sometimes the body, the macrophages will react to the platelets because the body will think the platelets is a foreign body and attack the platelets. Spleen, and then the third reason is the spleen holds on too much of platelets because the spleen is an organ in the abdomen that normally store about 1/3 of body's platelet. But sometimes when the spleen is bigger, or we call it as a splenomegaly, so the platelet count stored in the spleen is higher than the normal range. So it also helps in the fighting infections. So what are the symptoms of thrombocytopenia? First is bleeding that lasts a long time, even from small injuries. Petechiae, which are small flat red spots under the skin caused by blood leaking from blood vessels. Purpura, which is bleeding in skin that cause a red, purple, or brownish yellow spots. Nosebleeds or bleeding from gums. blood in urine or stool, which can appear as red blood or as a dark terry color, and also heavy menstrual bleeding. Thrombocytopenia can be treated by medications if it related to the immune system. So the medication that we'll prescribe is corticosteroids or platelet transfusion in a severe condition of thrombocytopenia. Thrombocytopenia can be diagnosed by a blood test to see the platelet count or physical examinations, especially the skin abdominal palpation. Abdominal palpation to see whether the patient has splenomegaly, and history taking, especially ask whether the patient has took any medications consumed, because thrombocytopenia also can caused by some medications like heparin. Next.
What do you say about the heparin? What's the function of heparin?
Heparin is to avoid the blood clots.
Why do you need the heparin?
If the patient or if a person have stroke or post-stroke patients, or the blood but heparin to avoid the blood clots.
Why usually we prescribe the heparin to the people with the stroke? Najwa, why do we give heparin?
Maybe to help prevent harmful clots from forming in the blood vessel.
Yes, very good. So you know that in the stroke patient, it occurs because of the formation of the thrombus or some fat deposit is blocking the normal flow of the bloodstream. Okay, so you don't want these things to happen. One thing that we can do is try to dilute it out or try to remove these clots inside the blood vessel by giving the heparin. Heparin is the anticoagulant, mean they prevent the coagulation of the blood inside the blood vessel. Okay, so always think like logically when people having the stroke, they have something stuck inside their blood vessel. It means that the normal blood flow that carry oxygen could not reach the brain. And now the brain is in the hypoxic condition. Okay, very less oxygen. That's why they tend to faint or become, unconscious. Because no oxygen means you cannot become conscious anymore. Like you are sleeping. When you are about to sleep, very few oxygens are being supplied to your brain, and at the same time you have the melatonin to promote the sensation or the feeling to sleep. So we prescribe the heparin in patient with this stroke. What are the other anticoagulant that we are commonly used in the hospital? Anyone know?
Warfarin.
Warfarin. Okay, commonly we use warfarin for what? What purpose? What disease? Anyone? Warfarin for what disease? What is warfarin?
Heart disease.
Very good. For example, name one heart disease that we commonly use warfarin. Anyone? Yes, yes. Anyone?
Maybe for someone who had a heart attack.
Okay, people with a heart attack or cardiac arrhythmias, where they have irregular heartbeats, commonly we use this. Have warfarin, yeah, warfarin. And what does this warfarin did? What does it do in patient with the heart disease? What did they do? Anyone?
It prevents blood clots from forming and growing larger in the blood vessel.
Okay, very good. Okay, it also acts as an anticoagulant. They prevent the blood from clotting. Right? So these the heart. So we have learned this before. The heart and also the vessel. We call it the cardiovascular system, where we can always see lots of build up of unnecessary materials. It can be food products or lipid molecules that is stuck inside this vessel, and it can, causing lots of complications to the people. So we don't want the blood vessel to become narrowed. Okay, so we need to widen it out by prescribing the heparin or warfarin. Okay, next. Can continue.
So lastly is the management of the bleeding. This is for just a small bleeding, not the severe bleeding. So what Maria can do is by pressing point pressure on the blood vessel so that it will stop the bleeding, and make sure to apply it using a clean towel. Second, she need to raise the area. By reducing the blood flow will help to stop the bleeding. If the wound is at the lower limb, the patient may lie down and try to raise it above the level of the heart. Next is ice. Ice will help to constrict the blood vessel and allow a clot to form more quickly. How to use it? We used to wrap ice in a clean, dry cloth before applying to the wound. And for the 2 point at the bottom, is what she should take to improve her blood clotting, which is vitamin K and calcium. Vitamin K can be found in leafy vegetables like spinach, lettuce, broccoli, and okra. Vitamin K is also can be produced in the body by the gut bacteria in gastrointestinal tract. While calcium can be found in the milk product, including milk, yogurt, sour cream, and cheese. I think that's it from us.
Okay, thank you very much. So you want to help to stop the bleeding first, okay? And of course, maybe you cannot see what are the really things that happen inside the system. Okay, you cannot see when is the intrinsic is occurring, where they convert lots of components, and after that they make enzymes until they reach the fibrin networks formation. So there's very long step, and what you can only see is that the blood can stop automatically. That is what you see. Okay, so of course you need to know, in some people with the blood disorders, they are lacking certain components. They are lacking certain anticoagulants, and that makes quite difficult for them to stop the bleeding. Okay, so there are lots of factors. It can be genetic. It can be due to some insufficient nutrients like vitamins. So this is all the contributing factors that makes it difficult for the patient or Maria to stop the bleeding. Okay, so this is the trigger one. Yes. Yes. Do you need the trigger two or not? No, you don't want.
Yes.
Still Hari Raya. You want to celebrate Hari Raya or not? Let me check. Okay, so this is quite general discussion when we are talking about the hemostasis, the mechanism, how the blood coagulation occur. The story continue when she was brought to the ED. Look at the chat. Okay, she was brought to the ED and the doctor transfused 1 pack of blood. And history taking revealed that she has been taking warfarin since last year due to history of mild stroke. And the complete blood count, the CBC, was normal. And further blood tests revealed no clotting factor deficiency. Right? All those Aisha already showed us all the factors involved. Okay, unfortunately, this patient don't have any deficiency of the factor. All the factor is there in her body. And the prothrombin time indicate the clotting time was longer than 13.5 seconds. Okay, even though her clotting factor is sufficient, but still the time taken was longer. There must be something is happening to her. Okay, maybe they are lacking something. What are the things? What are the components that are missing? Because she's still suffering from having a good amount of time to clot her blood or to make the blood clots properly. Is there any information that you need more, or is it enough? Good. You think it's enough for now? Yes? Make sure you discuss among yourself, okay? All right, so this is gonna be the last PBL. So if you want to do or to make it early, maybe we can do it tomorrow, okay? Or maybe the day after tomorrow, okay? Because we missed 1 class. Suppose today is the last, last class or the PBL, but we missed 1 class last time. Can we do it tomorrow? Yes, okay, thank you. Why you are smiling? You have an open house tomorrow.
Some students have IBG tomorrow.
What is IBG?
Inter-batch game.
Yes, you can still play games. Like Putri still play badminton and still can attend PBL.
Don't know what about others.
Others okay tomorrow or you want next week? You tell me what time you want.
Next week, I have IBG games tomorrow.
What time we want to continue the discussion? So tomorrow is okay because there's no objection on that. Okay, Azim, okay. Okay? Not okay. Okay, why Najwa Jihad? Why? Why it's not okay?
I have IBG games tomorrow.
You also involved in the games. Who else
Yeah,
involved in
yeah.
the games?
Me,
Who is me?
Aisha.
Aisha, so what do you play? You know how to play badminton? Everyone is involved with tomorrow. Okay. Okay, we try to do it next week. Okay, you let me know if you can do it earlier. Not necessarily on Friday, but just remind me earlier so that I can find the time for you. And also, please take care if you are involved in the IBG for tomorrow. Make sure you don't get any bleeding out of that spot. Okay, and if you do, make sure you have to be prepared on the last slide. Make sure the ice is there. Okay, all the spinach, the vitamin K, all the vegetable, you need to bring it together. Okay, bring the milk, everything. No, I'm just joking. Okay, so I'll see you again next week. I hope you enjoy the rest of the weekend. You take care and also keep informed with the current SOPs. Right, so we're gonna have our final PBL class next week. So you let me know when is the time. If there's no more question, I think we will end up to this point. Okay, is there any question from the floor? No question? Okay, thank you so much, everyone. We close the session by tasbih kafarat suratul asr. Okay, bye-bye, everyone. Bye-bye. Bye-bye.
Thank you,
Thank you,
Doctor.
Doctor.
Thank you, Doctor.